In today's health headlines, can olive oil lower risk of dementia? What to know about the first case of bird flu transmitted mammal to mammal? And patches may be a new method to give kids vaccines. Joining me is Dr. F. Perry Wilson, Associate Professor at Yale School of Medicine, Yale Medicine physician. Welcome.
Thanks for having me.
All right, a new study is suggesting that consuming olive oil reduces the risk of dementia-related death. What do we know about that?
Yeah, so this is interesting. Olive oil sort of keeps coming up as a potential healthy source of fat in your diet. This was a study of around 100,000 people. They were all health professionals in the U.S. Who reported, based on a survey, how much of various different kinds of food they ate, including olive oil. And they were followed for about 20 years. And what the researchers found was that the people who ate more than 7 grams of olive oil a day, that's a couple of tablespoons, had a 50% lower risk of dementia-related death compared to those who didn't eat any olive oil. Now, of course, there are some things that people who eat olive oil might be different than people who don't eat olive oil. For one thing, olive oil is somewhat expensive. And so when they adjusted for things like socioeconomic status, that relationship did decrease a little bit, but there was still a signal of protective effect. So if you like olive oil, some good news there.
All right, I'm going to put it in my coffee.
If you can drink it.
Yeah, right. All right, the first case of bird flu transmitted mammal to mammal seems to have spread from a cow to a human. Is this alarming?
Yeah, this is something we need to keep a close eye on. So the bird flu, as its name implies, is widespread in birds, particularly poultry is a potential source. But we know that bird flu has been infecting cattle in the United States. There's been a number of news stories about that, potentially even the milk supply. But there hasn't been significant risk to humans. But now we have the first case of, this was a dairy worker in Texas who was working closely with an infected cow, not wearing a mask, but wearing gloves, and who contracted bird flu. That's the first time that we've seen this mammal to human transmission as opposed to bird to human transmission, which does make you worry because mammal to mammal and human to human is often the next step. One thing that looks okay, though, is that the genetic analysis of this flu shows that it's not very different from what has been circulating in birds. So it's not like this is a mutated version that is going to be much more efficient at transmitting into humans. At least that's the hope, but clearly something that we'll need to be keeping an eye on in the coming weeks.
All right, and finally, a type of patch is a new method for administering vaccines to kids, and they seem to work really well. This would be great.
This is so cool. Yeah, this is a new patch. It's about the size of a postage stamp, and it has, these tiny microscopic points on it. I guess they're needles, but they don't really, they don't cause bleeding or anything like that. And this was successfully used in a study in the Gambia to administer rubella and measles vaccines to about 100 kids. Their antibody levels went up just like they would with an injectable vaccine. But what's so great about this, aside from not needing to get a shot, it's painless. It also doesn't need to be stored in cold conditions, which is great, especially for underdeveloped countries. And what's more, it can be applied by someone with really minimal training. So in terms of these places where you want to get vaccines to a lot of people and you might not have as many health professionals, it's minimal training to learn how to apply this patch. So I'm really excited about it.
I hope that's on the horizon soon. Thanks so much for being with me today.